So here I'm going to discuss briefly herpes simplex virus type 2, which is transmitted sexually. It's a sexually transmitted disease. So herpes simplex virus 2 is going to have worldwide distributions, and humans are the only host, so human-to-human transmission is what keeps this virus going. And transmission is going to be through direct contact with infected secretions. You're going to have a large portion of the population have antibodies against herpes simplex virus 1, which is typically going to cause cold sores. And antibodies against this virus, herpes simplex virus 2, is rarely seen before puberty. Now, many patients are going to be asymptomatic, so they don't know they're infected with herpes simplex virus 2. The lesions are small and they might go unnoticed, and they can shed the virus and transmit the infection. In asymptomatic patients can transmit the infection to other people. There's about 1 million new cases every year in the United States, and we have both acute and latent types of infection. So our latent infection, the virus has been shown to be in the sacral region, so it hangs out in the nerves in the region S2 to S3. The infection is going to not kill the neurons. Its effect on that actual neuron is not known. But during this period of time, there is no synthesis of proteins, and most antiviral drugs cannot target this latent infection because the virus is, in essence, inert. Reactivation of latent virus is going to be the most common cause of recurrent genital infections. There are some precipitating factors. Exposure to UV light, fever, and trauma can all be triggers to reactivate. And genital herpes infections are going to be primary, recurrent, or neonatal. So for primary genital herpes, you're going to have lesions that form within 3 to 5 days, and they are going to be painful coalesced ulcers. The lesions are all going to crust over eventually, and they are usually going to be bilateral and extensive. Bilateral enlargement and tender lymph nodes in the groin are also going to persist even after the lesions have been cleared. About a third of the patients are going to show systemic symptoms such as fever, tired. Some cases you're going to have aseptic meningitis, so this is a virus. It does not cause pus, and so it's going to cause an aseptic version of meningitis. The episodes of primary genital herpes will last in about 12 days. So you're going to start with a redness or swelling in the area, and then you're going to get your fluid-filled vesicles and pustules, and then you're going to have crusting, healing of the vesicles or ulcers. Recurrent genital herpes are going to have shorter durations because you have an immune response now that will clear the virus quicker as when it gets reactivated. It's usually going to be localized to the genital region. It's not going to form meningitis, for example. The symptoms are going to be burning or prickling, and you're going to have about this sensation about 24 hours before you get vesicular lesions. The lesions are usually going to disappear within 2 to 5 days. 80% of patients infected with HSV2 are going to have recurrent episodes, and they're going to have about 4 to 5 episodes per year. There also can be shedding without disease, of course. Neonatal herpes simplex virus 2 can result from transmission during delivery. Herpes viruses cannot cross the placenta. This is going to be associated usually with a primary infection by the mother at or near the time of delivery when the mother does not have an immune response to control the infection, and the baby gets born and they get transmitted the virus. You're going to have a serious infection with herpes 2 in the newborn with a mortality rate about 60%. Of those that get infected during birth, if they survive, they're going to have severe defects of their nervous system. They're going to have necrosis of liver. They're going to be listless, and they're going to develop seizures. The most common treatment is a nucleoside analog drug, acyclovir, and this is going to decrease the primary infection. There's also some other treatments which in herpes simplex viruses that are resistant to acyclovir. And of course, you can prevent the infection by avoiding contact with infected individuals, especially those with lesions. But it's important to remember that you can spread the virus even if you're asymptomatic. And it can be transmitted via saliva, similar to herpes simplex virus type 1.